A state rule that forces Planned Parenthood out of the Texas Women's Health Program goes into effect today.
Now 130,000 low-income women might have to find another way to get everything from cancer screenings to contraceptives. It all stems from a fight between the state of Texas and the federal government. Political reporter Josh Hinkle explains.
Those cuts of funding are definitely going to impact us greatly.
At Lone Star Circle of Care in Georgetown, Dr. Tamarah Dupervall Brownlee worries her network of Central Texas clinics will have to fill a major hole in the women's health program.
How do we continue just to provide services for the roughly 2,300 women that we take care of? Fulfilling a $700,000 gap is pretty significant.
The program provides cancer screenings, birth control, and basic health care. Lone Star was a clinic the state had no problem giving that federal funding, but Planned Parenthood was a sticking point.
The Texas legislature in 2005 passed a law saying that tax dollars will not go to abortion providers or their affiliates.
I think the message got sent today.
Perry's administration said none of this money would go to Planned Parenthood. So federal officials plan to cut the state off completely.
Maybe they don't want us to have freedom, but we're fighting back.
This week, a crowd swarmed the Texas Capitol, some speaking out against Perry.
It's a war against women's health.
Others speaking out against the president.
He wants to take that funding away if we don't bend to his will of including Planned Parenthood in that.
This program helps more than 100,000 low-income women in Texas with more than 2,500 qualified providers. That's enough, the governor's office says. Women who were with Planned Parenthood before should still be able to find care. They also say that the state should be able to find $30 million to help foot this bill for an entire year.
It will be a matter of prioritizing what is there in existing funds.
While it's still unclear where the state will find that funding, Dupervall Brownlee is hopeful something will come through.
At the end of the day, we'll always remember the faces of the patients that we take care of.
Josh Hinkle, KXAN News.
In a statement, Planned Parenthood Texas Capital Region told KXAN no one's politics should interfere with a woman's access to health care. It is shameful that Governor Perry continues to politicize life-saving breast cancer screenings and birth control access for low-income women.